Hi, and welcome to this video on group therapy created for Newfoundland and Labrador Health Services. My name is Jackie Butt, and I'm a social worker in the position of Provincial Groups Coordinator for the Mental Health Program. My role is to help create and facilitate mental health groups in this province. As a social worker in the field of mental health and addictions for over 25 years, I have had the opportunity to facilitate many types of groups. From being a young new graduate to now being in the later stages of my career, I continue to feel excitement, passion, and awe when having the opportunity to be a part of group-based therapy. Excitement as I get to be a part of the recovery journey for new people. Passion as I believe in some of the unique opportunities that groups provide. And awe for the courage and inspiration that group participants demonstrate and share with one another in their recovery. I want to talk to you about group-based therapy. You may be watching this video as someone has suggested to you that you might benefit from joining a therapy group. Or maybe you are interested in this option and are uncertain what to expect. I hope that by the end of this video, you will know a little more about group therapy and feel more able to make a decision as to whether this service option is right for you. First, let's start with some of the basics. Group therapy is not the same as one-on-one therapy, just with more people. Group therapy is a unique, valuable, and evidence-based approach to addressing mental health and addictions issues. It is not a substitute for, a second best, or a backup option to individual services. Mental health groups are usually run by two clinicians who have a background in social work, nursing, psychology, or another professional discipline. These clinicians have skills and knowledge around therapy and mental health which they are able to use in a group setting. Group sessions usually occur once a week and can be from 1 to 3 hours long. Many people have anxiety and fears about participating in therapy overall, and perhaps even more when they think about participating in a group. Let's look at some of the common fears people identify. One of the fears that people most often express is that they will know someone in the group or that their privacy will not be maintained. While we cannot guarantee you won't know someone in the group, we can assure you that privacy and confidentiality are a priority and an expectation that all group members must agree to. Facilitators review these expectations with all members prior to starting a group, and we discuss the reasons confidentiality is so important to the group's success. So, participants agree to maintain this privacy prior to starting group, and this is again reviewed in the first session so as to reinforce this important component for group safety. Additionally, all individuals who come to group are coming with a similar mental health issue, so will have the same desire to participate in a group that will function effectively for all. If you did happen to know someone in a group you attended, you can be certain they are coming for similar reasons that you are coming for. If there were other issues connected to this concern around privacy, the facilitators of the group are available to provide specific supports and to help address any issues that may arise. Another common worry is a little the opposite to this initial fear. People often express, "I won't know anybody," or "I am too nervous to join a group of strangers and talk about my personal experiences." This is a very understandable fear as well. We all can feel very vulnerable and scared to talk about our personal struggles and problems. We may fear being judged, not fitting in, or of experiencing rejection. We would like you to know that almost every other person who will be in a group will also have these same fears. In fact, overcoming this fear over the course of a group is actually one of the powerful, unique benefits of attending a group. But we will talk more about that topic later. For now, it may be helpful to know that group facilitators know that most people have this discomfort and fear as they begin a group. We will provide opportunities for group members to get to know each other in a way that it feels safe and is a gradual process. You will not be expected to come to a group and share intimate details about yourself in the first session. In fact, depending on the group, you may never need to share much information in depth. Additionally, group facilitators are present from the time of arrival for group, so they will be there to welcome you and help you settle into your first session, helping you to become more comfortable. In response to both of these potential concerns, it is helpful to understand that the group facilitators prioritize safety in the group setting. Group facilitators are skilled at being able to create and maintain both physical and emotional safety for all participants. This is done in various ways throughout the group process, from initial screenings for groups to setting group rules and expectations with members, and by creating boundaries within the sharing and interactions. Another fear expressed is that the group won't be helpful. Many people have developed the belief that individual therapy is the best and only way to truly address mental health issues. Some people may also fear that their situation is different or too complex to address in a group. Group therapy has ample research and evidence to support its effectiveness to treat many mental health issues. If you have been accepted into a group-based intervention, please know that it has been determined that this can be of benefit to you. Issues such as anxiety, depression, and other emotion dysregulation issues are well shown to benefit from groups. Addictions, grief, family supports, and coping are other topics and issues that are also well treated in group-based therapy. One of the biggest factors determining success is a participant's willingness to engage in the learning and sharing in group, as well as their commitment to transfer this learning and practice into their day-to-day lives. This is also a similar predicting factor of success in individual therapy. We regularly talk about the 3 P's: patience, persistence, and practice in recovery. Patience acknowledges that progress does take some time and recognizes that recovery can be an ongoing journey. Persistence means not giving up when there are setbacks and obstacles. And practice means that we are willing to put in effort to try new things, recognizing that what we have been doing is not working. Continuing to talk about how to get the most out of your group experience, it may be helpful to talk about how to get the most out of any therapy. When we think about group therapy, we may picture something like we may see in the movies, a group of people sitting around in chairs, drinking coffee, and taking turns to talk about their struggles in life. In reality, group therapy is actually more goal-focused and often more structured. Groups are usually focused around a specific issue such as addiction, depression, trauma, and so on. Additionally, therapy in any form has a focus on supporting recovery. Recovery can look different for each person, but overall it means moving toward a life that has meaning and value for the individual. Recovery in mental health does not always mean the absence of struggle or symptoms. Rather, it means learning how to live and cope with these struggles and symptoms in a more effective way. That said, it is helpful for individuals to have some personal goals they would like to work towards as they begin therapy. For example, a person may say they want to improve or increase their connections with others, or they may want to decrease or stop substance use. They may want to learn how to manage symptoms of anxiety or depression so they can engage in activities that are meaningful to them. Again, as mentioned, having patience around accomplishing this goal and setting realistic goals over time is most helpful. Being willing to try new things is also very important. Group therapy can help support all of these aspects of recovery. Now to highlight some of the unique benefits of group therapy. As mentioned, the effectiveness of group therapy is well researched. For some people, it can offer advantages that may not be available through individual psychotherapy. For example, people who feel alone in their struggles may gain confidence and encouragement from interacting with peers who are in the same boat. According to CAMH, a Canadian leader in mental health services, here are some other key benefits of group therapy. The group dynamic allows members to feel supported and accepted, and it can reduce stigma and isolation. The similarities among members can provide a sense of community, while the diversity of experiences can spark ideas for new ways of coping with challenges. The group provides a safe environment in which to take social risks and experiment with new ways of interacting and behaving. Members can gain hope and learn from the strategies of those in their group who are further ahead than they currently are in their recovery. Group therapy also allows members to better understand how they relate to others and to make positive changes in their relationships. And finally, observing the group in action gives the therapist a window into how each member functions in a social situation, which can result in valuable feedback. Because of these unique aspects of group, therapists often see participants make more progress in the duration of a group than they would if that same person attended the same number of sessions in individual therapy. There are some different types of group formats and processes available. I will explain some of these differences and options. First, groups can be open or closed. Open groups mean that new people can join the group at any time, and thus it is often offered on an ongoing basis. A closed group is one where, once it starts, new people cannot join. Closed groups are often for a set amount of time that could vary from weeks to months. You will be asked about your interest and ability to commit time to a group to determine which option may work best for you. Both options have benefits and work best for different settings. Secondly, groups can be what is called psychoeducational or process, and some groups can be a combination of both. Psychoeducation groups have a focus on sharing skills and knowledge for participants to apply to their own situation. For example, we might have a group where we teach mindfulness skills or assertive communication with the goal for participants to learn and use these skills to improve their lives and address their mental health issues. Alternatively, when a group is identified as process, that means there may be more of a focus on a theme or idea, and then the group participants share, reflect, and process how this fits with their life. An example might be exploring how family relationships were experienced and the different ways people were and are impacted by their family. Again, neither option is better or worse. They just approach recovery and mental health in different ways. There are also some other types of groups, such as peer support groups, that are run or offered with people who have lived experience with mental health or addictions. Examples of peer support groups available in our province include groups such as AA, NA, U-Turn, and LifeWise. It may also be helpful to know that there are options to attend groups both in person and virtually throughout the province. While COVID has been a challenge for all of us, one silver lining might be that it has opened up the opportunity to access connections through virtual means. In Newfoundland and Labrador Health Services, we use Zoom for Healthcare as a way to connect and provide services when in-person contact was not possible. Using Zoom in this way has allowed us to provide services in new ways in mental health. We switched to offering virtual groups with great success and positive feedback from facilitators and participants alike. Now, as COVID may not be as great a barrier, we are able to continue to draw upon the benefits that have come from virtual groups. Many have said that they like the option to attend groups from the safety and privacy of their home. In winter months, when the weather is unpredictable, not having to venture out in the snow has also been welcome. Additionally, if a person doesn't have access to reliable transportation, virtual options can be welcome. Now we are also seeing the possibilities to offer groups to larger geographic areas so that some remote and rural areas of our province, who may not have been able to avail of groups previously when the distance to larger centers was too great, now can do so. In the new Provincial Health Authority, Newfoundland and Labrador Health, groups are provided on a regional or local level, and there are also groups offered at a provincial level. All provincial groups will be offered virtually so as to make them accessible to all areas of the province. However, regional groups may be offered either in person or virtually, depending on the needs of each area. In our province, while we have a number of mental health and addictions groups available, we are also working to expand on our options. If you want to access more specific and current information, please contact your local community mental health office, or you can connect with us, the provincial group's coordinators, who can help answer your questions. I hope that this video has helped to answer some of your questions as to what to expect from group-based therapy, and that in doing so, it has decreased some of your fears and worries. Please know that it is still quite normal for some anxiety to remain. This connects with one final benefit I would like to acknowledge for attending groups. People who overcome that understandable fear and follow through in attending a mental health or an addictions group have such a feeling of success and a feeling of increased confidence once they finish. Knowing they were able to take this step for their recovery helps them to continue to take further steps in the future. Perhaps hearing from a person who attended a mental health group can illustrate this best. This person said, "Anyone struggling with a mental health issue will be given a wealth of knowledge and the tools needed to start the journey of loving themselves again. This group is intense. You will have light bulb moments, eureka moments, and feel every emotion from head to toe over and over. The support and compassion that is shown by the leaders of the group is multiplied by the support you feel from the others on the same journey. It's intimidating at first, but that feeling is very quickly replaced with care and hope. The age range of the participants will quickly show you that it's never too early or too late to take control of your mental health. You will look at yourself very differently after each session, and bit by bit you will put all the puzzle pieces together and know what your path forward needs to look like. The road is full of potholes. The stops along the way will make you think differently, but every week will resonate with you on one or more level. You go into this as a worn and withered bunch of flowers and come out as a beautiful rose bush taking root and ready to bloom. Do the work presented to you, invest your time to see this through, bring tissues and allow yourself to feel the goodness in every small step you make towards being your best self." So, as you can see from this testimonial, attending group can be such a powerful experience for anyone who chooses to participate. We welcome you to attend a group that you feel is a good fit for you and your specific goals and needs. Thank you.